video goes through a series of exhaling with effort. This is going to be really good to help minimize if you're having any kind of stress incontinence symptoms. So that's leakage with the coughing, sneezing, lifting, moving around. So first we're going to start lying down on your back. Just a quick review of that reverse Kegel. So that's going to be a Kegel contraction is just activating your pelvic floor. So kind of similar if you're going to stop the flow of urine. So to do that, you're going to find your sit bones. We're going to try to bring them together and then gently drawing up and in towards your belly button. So we're going to time that with our breath. So you're going to breathe into the pelvic floor, nice big breath in. And then as you exhale, we're going to time it with that gentle pelvic floor contraction, trying to bring everything together and then up and in. So we're going to try that a couple times, inhaling and then exhaling with that pelvic floor contraction. Try that a couple times. When that becomes easier, then we're going to start to time that with our transverse abdominis contraction. So we're going to breathe in through the pelvic floor, and then as you exhale, trying to activate the pelvic floor first, and then trying to draw that transverse abdominis in by bringing that belly button towards your spine. Practice that a couple times. Inhale through the pelvic, inhale through your mouth into the pelvic floor, and then exhale, trying to draw the pelvic floor in and the transverse abdominis in with it. To progress that next, you can get a yoga block, a bouncy ball from the grocery store, a pillow, and you're going to place that between your knees. So we're going to time the same contractions that we were doing before, which is that little light squeeze to get the adductors on board too. So breathing in, you can breathe in through your nose, breathing into the pelvic floor, and then exhaling, trying to get the pelvic floor to engage, the transverse abdominis to engage, and then a gentle squeeze of your knees, trying to squeeze into the ball, block, or pillow. See if you can hold 5 to 10 seconds and then let everything just relax. No pain should happen with any of these exercises, so we'll try that again. Breathing into the pelvic floor, and then exhale, pelvic floor, transverse abdominis, gentle squeeze into the block. When you're ready for the next step, we're going to add a bridge, pushing through our heels and lifting our hips up. So we're just building on each exercise. So again, breathing into the pelvic floor. And then as we exhale, trying to get that Kegel contraction, transverse abdominis, gentle squeeze. When we have that, then we're gonna press, lifting our hips up, keeping that nice neutral position. See if we can hold 5 to 10 seconds and then slowly coming back down. So we'll try that one more time, breathing in. Exhale with all our contractions, Kegel, transverse abdominis, adductors, and bridge. And then back down. So next we're gonna try that with sit to stands. So I wanna make sure whenever we're lifting, we're not bearing down, or whenever we're lifting from the table, we're not bearing down, we're not holding our breath. So you're gonna do that nice exhale first, and then you're gonna try to stand up. So that's gonna look like the inhale, breathing into the pelvic floor, and then exhaling and trying to stand up as we get the Kegel and the transverse abdominis to contract. So trying that again, inhale to the pelvic floor, and then exhale, getting some of that contraction, and then trying to stand up.